Eric Hammer, registered physiotherapist here. Today I'd like to talk to you about some of the progressions I'll do for somebody who might be having some struggles with their hand behind back movement. But before I continue, please hit that subscribe button below so you'll be notified about any new material I have here on my channel. So essentially, a lot of shoulder patients that I'll see in the clinic, they'll have a limitation with regards to their ability, right, to bring their hand behind back. In a lot of cases, what will happen here is they've got a really tight anterior capsule of the shoulder, right? So you'll see this a lot with patients who maybe the shoulder's a little bit deconditioned, they haven't been using it for a while. They might have had some rotator cuff issues in the past. Perhaps they've had like a frozen shoulder that they're starting to come out of. So there's all sorts of potential reasons, right, for this hand behind back limitation. But I want to go through the steps typically that I'll take if an extension biased protocol is in order in terms of treating the shoulder. And so what I mean by extension biased is when a patient repeats, right, extension back, their mobility is improving, right? And so essentially what I'll do here is I'll start a patient off, right, by grabbing some kind of a stick, like a broomstick works really well, and basically having them repeat this extension movement back. And so again, essentially what we want to make sure of is that they're not, it's not creating a greater amount of restriction post-extension. There might be some discomfort. If there's pain, right, essentially the idea would be you back off once the pain comes on, right? So as I'm repeating, I'm not pushing into pain. And then ideally, as the patient is repeating, hey, I can go a little bit further before it comes on, and all of a sudden, hey, I've gained some range there. If there is no pain and it's just the shoulder is just kind of stuck, then I'll have the patient go into a bit more of an aggressive approach in terms of the extensions back. So that's kind of phase one. Then the next component, right, is I'll actually have the patient to some degree pull the arm to the opposite side. So again, we've done the extension. Now I'm going to the opposite side with the hand, okay? And then the final component, again, so extension, out to the side, and then I'll either have the patient repeat, just like we've done with the stick, extensions up with the opposite hand, or what works really well, again, repeating but with a towel, right? So I'll have the patient hold on to the towel here, and we're just pressure on, pressure off, right? So again, typically it's about 10 to 15 of these repetitions back and then on each phase, and then we're going to monitor throughout. Is it becoming more or less restricted? How's the pain level? We're not pushing into pain. If it's just a restriction, we can push into it. And again, we're just making sure that the after effects of it is that I'm gaining range, and we're not going into what's referred to as muscle guarding. So if there's some discomfort or pain, the muscle will basically go into a protective spasm. That's what we want to avoid. If you have any questions or concerns, please hit the reply button, and please make sure to check with a physiotherapist or a doctor to make sure that this exercise is appropriate for you. Thanks again for watching, and have a great day. Take care.